Hi everyone, my name is Samantha Mitchell and I would like to start off by stating an outrageous statistic. According to the Center for Disease Control and Prevention, each year about 10,000 babies born in the United States will develop cerebral palsy. 10,000 babies is a terrifying high number. In this speech, you will learn the numerous points of evidence regarding cerebral palsy. Now that I have interested you, let's put that overwhelming statistic aside and move on to something a little simpler to start with. The Numerous Foundation defines cerebral palsy as a disorder that affects muscle tone, movement, and motor skills. Cerebral palsy is caused by abnormal brain development or damage to the evolving brain. This disease occurs before or during childbirth and may also occur in a child's first 3 to 5 years of age. Every child that has cerebral palsy has problems with movement and posture. Now let's all just take a brief moment to really think about that statement. Imagine if one of those children was your daughter or son. The first thing that pops into my head is, how would I be able to help my child live the best life with these huge limitations? Many people, including myself, take things like walking and talking for granted. These quote, simple day-to-day tasks are not simple but practically impossible for children with cerebral palsy. This disease affects children worldwide, and who knows, that next case could unfortunately involve my child, your child, or someone in your family. I personally had the honor of working with a little girl that has cerebral palsy. I can honestly say that she was the happiest child I have ever met. She never once let her disorder get in the way of anything that she wanted to accomplish. The most beautiful thing was that she didn't even realize that she was different from the rest of her peers. She has inspired me to learn more about this disease by writing this speech. First, I will describe the many causes within the main cause of cerebral palsy. Second, I will explain the risk factors that follow cerebral palsy and the ways to prevent it. Third, I will discuss the 6 different types of cerebral palsy and the 8 factors that determine the life expectancy. Let's examine why every child's case is so incredibly individualized. Every child's case is unique because of the type and timing of the injury to the brain. There are 4 disorders that can cause the abnormal brain development or brain damage. The first disorder is prenatal disturbance of brain cell migration, which is during brain development when cell migration is disturbed by genetic and environmental factors. Prenatal poor insulation of developing nerve cell fibers is when brain function is diminished when the myelin does not adequately cover nerve cells, which supports transmission. Prenatal brain cell death is due to a lack of oxygen or when blood vessels rupture in the brain during the birthing process. The final disorder is postnatal non-functional brain between brain cells. This is when connections are due to asphyxia, infections, and trauma, which is a fact from Stern Law Group. Now that we have covered the main causes of cerebral palsy, let's move on to the risk factors that are involved. There are risk factors that follow cerebral palsy, but there are also ways to prevent it. Risk factors include preterm or low-weight birth, brain infection, and injury. Children who do not receive certain vaccinations have a higher risk of receiving a brain infection. Insufficient protection measures give a child a higher risk of enduring an injury. Performing responsibilities before, during, and after pregnancy can have an increased prevention rate for cerebral palsy. Now that we have gone over the risk factors of cerebral palsy, we can move on to discussing the different types. There are 6 types of cerebral palsy and 8 factors that determine the life expectancy. The 6 different types include acquired, congenital, spastic, ethtoid, ataxic, and mixed cerebral palsy. Acquired cerebral palsy is due to damage or injury after birth. This type of cerebral palsy is not very common. About 20% of young cerebral sufferers have acquired cerebral palsy, stated disabled lawyering. Congenital cerebral palsy is contracted at or during the birthing process due to an infection, disease, or damage. Spastic cerebral palsy is when movement is extremely restricted because of firm muscles. This type of cerebral palsy is very common, makes up about 80% of cerebral palsy sufferers, according to disabled lawyering. Ethnoid cerebral palsy affects the sections of the brain that help with posture and coordination. This type of cerebral palsy affects about 10% of children that suffer from the disease and can affect coordination, posture, and muscle tone, stated disabled lawyering. Ataxia cerebral palsy affects balance and perception. Disabled lawyering also stated that around 5 to 10% of cerebral palsy children suffer from this form of the disorder. Lastly, mixed cerebral palsy is a grouping of all types of cerebral palsy. The most common is a mixture of ethtoid and spastic cerebral palsy. The life expectancy for children who have cerebral palsy depends on 8 factors. The 8 factors include the number of impairments and disabilities, severity level, mobility limitations, feeding troubles, seizures, cognitive functioning, visual perception, and respiratory function. All of these factors play a huge role in a child's life expectancy. Now let's look back at the key points that we have previously covered regarding cerebral palsy. First, every child's case is unique because of the type and timing of the injury to the brain. Second, there are risk factors that follow cerebral palsy, but there are always ways to prevent it, or you can try. There are 6 different types of cerebral palsy and 8 factors that determine the life expectancy. I hope that this speech helped you learn the numerous points of evidence regarding cerebral palsy. Now be sure to remember that people are faced with challenges every day. It's just whether you choose to succeed or to give up that makes all of the difference. Thank you for listening.